Now we're going to use the body fulcrum, which you can get at bodyfulcrum.com, for a very basic workout. First, we're going to do some active pelvic tilts. So again, here we have a big gap underneath the lower back called the lumbosacral spine. And we're doing active pelvic tilts, which means we're tightening up the stomach muscles in order to flatten the back out. There may be some gluteal contraction, but do your best not to contract the hamstring because it'll cramp. All right, after we finish about 10, we're just going to roll on your side. So go ahead. And here the fulcrum is staying below the waist, so it stays well below the waist, just a little bit. And then you're going to tighten up both your hands, or the weight's going to come on the palm of the hand. Tighten up the tricep like you're doing a push-up. Lean this way, and then just do 10 up and down. Tap the floor and lift up. Tap the floor, and notice the top foot is over the top. If you need to do it even more basically, you would just do an isometric. So here, Joanna's just going to show you an isometric. Just hold it there, and then that'll work well. Then you're going to roll back onto your back, and we're going to return back to just 10 simple active pelvic tilts. No, we're going to do basic ones only. So yeah, so pelvis, the body fulcrum is below the pelvic bone, and again, we're just doing flattening this area out. Okay, so the pelvis, the top of the pelvis is right about here. The iliac crest is just lengthened up. This is a far superior way to do pelvic tilts because we're getting decompression or active decompression, which is like having spinal traction, but a very doable way at home. So now she's going to roll onto your other side. And the fulcrum is shaped like this. There's the body fulcrum. And right now she's down in this valley with her hips. Again, she's going to tap her feet down flat, the top foot coming across. And as she does so, the pelvis is moving into lateral bending, forward and backwards. Just like that. And after she gets 10, and you want to stay in a nice straight line through the whole body, pressure on the heel, contraction of the tricep. Then she's just going to roll onto her back. And we're going to finish up with 10 more with the fulcrum below the waist. Drop down just a hint lower. There we go. Again, this is the basic way, and then she's just going to roll the pelvis down and up. So you want to do somewhere between like 10, 20, or 10 to 30 of these basic movements from this active pelvic motion. The side lifts, somewhere between 5 and 10 per side until you get stronger, or just hold it for 5 to 10 seconds if you're a beginner. And that's it.